Okay, welcome everyone. Thank you so much for joining us, and thank you so much to AARP for supporting all the work that we're doing at Hispanic Federation. Before I introduce our speakers today, I would like to make sure that everyone is a little bit familiar with some of the tools we have for the Zoom webinar. Upon entry to this webinar, you were muted, so you will remain that way. If you have a question, I ask that you please put it under the Q&A chat function. I'm sorry, not the chat function, the Q&A function. So you will see that icon Q&A. If you put it under the chat, your question may get lost. So please put it under the Q&A icon. If anyone likes the questions that are being submitted, please like them. That way we know we can kind of gauge which ones we should be asking, because we may not have time to ask all questions. Please use the chat function for any comments or elaborating on any ideas you may have. And of course, tenemos interpretación en español. Si van abajo en la parte baja de su pantalla, van a encontrar un icono que tiene esa palabra interpretation, y ahí pues, van a escuchar la conversación en español. And I'd also like to let you know that if you text Salud to 40649, you would be signed up to receive health updates from Hispanic Federation and AARP. So please text Salud 40649. And I am Betsy Morales-Ree. I am the Senior Director for Health Initiatives at Hispanic Federation. And I will be moderating this conversation and interviewing our guest speaker for today. So I'd like to first introduce you to Yvette Peña, who is an accomplished award-winning marketer and community advocate with over 20 years of experience, specializing in multicultural initiatives. Named Vice President for Latino Audience Strategy at AARP in 2016, she has led the strategic development of AARP's brand campaigns targeting the Spanish-dominant and bilingual segments, resulting in significant brand awareness increases. So thank you, Yvette, for being with us.
My pleasure. Thank you so much, Betsy. Hola. As Betsy mentioned, I am Yvette Peña, and I thank you for joining us this evening. AARP is proud to partner with the Hispanic Federation and Dr. Akbar on this important topic. We are champions in bringing the issue of mental health into mainstream conversation and keeping it there. Today's conversation about how the COVID-19 pandemic has shed greater light on the impact of racial inequities and systemic racism on Latino health is an extremely urgent and important conversation to have. We have the responsibility of getting our people to the other side of this public health crisis, now more than ever. 2020 has taken a mental toll on each of us, but especially for Gen X and older millennial Hispanics. In fact, 79% report feeling stress and 71% are experiencing sadness. Can you please have the translator mute herself? Thank you, because I hear her. For many Latino households, mental health is not a topic discussed at the dinner table, but it needs to be. And our comunidad needs to know that there are resources available. Because of this stigma, only 1 in 10 Latinos will approach a mental health professional. It's how we were raised. Latinos prefer to cope with mental health issues by seeking advice from friends, family members, or spiritual advisors, anyone but a professional. In a recent study on Hispanics conducted by AARP, when asked if they had difficulty dealing with the pandemic on a personal level, most Hispanics agree that they have. Yet when asked directly about their mental health, only a third say it's an issue. The study shows that there is still so much work to be done in demystifying mental health among Hispanics. And tonight's discussion is one big step in the right direction. For 5 years now, AARP has been collaborating with the Global Council on Brain Health, an independent group of scientists and health professionals, scholars, and policy experts representing 26 different countries. We translate all of their brain health reports into Spanish and expand our reach to Latino communities. Topics include nutrition, heart health, and more. You can learn more at the Global Council on Brain Health.org. We invite you to also take care of your brain health through a program that we have that's called Staying Sharp. It takes guidance from the Global Council on Brain Health and shows you how you can take every day, including adding music to your daily routine, reading articles, watching videos, trying new recipes, and playing fun games. And you can find some information on Staying Sharp at AARP.org. So as you can see, at AARP, we bring you trusted information and resources to help empower you to choose how you live as you age. Muchas gracias for joining us tonight. And remember que juntos es posible.
Thank you so much, Yvette. Okay, and now I would like to introduce you to our guest speaker. Sorry, okay. And our guest speaker is Dr. Maysa Akbar, and she is a groundbreaking psychologist, best-selling author, and healer. Dr. Akbar is a thought leader and expert in racial trauma, allyship, diversity, equity, and inclusion. She is an engaging and dynamic speaker who is sought by corporations, philanthropies, nonprofit organizations, urban school districts, and social service agencies in their efforts to promote anti-racism and advance racial equity. She brings insight, courage, and passion to her conversations with communities of color and white communities alike. Welcome, Dr. Akbar.
Thank you. Thank you for having me here.
Awesome. So our first question that we would like to ask you is, so we know that the COVID-19 pandemic has disproportionately impacted communities of color. For example, you know, we've seen this in higher, well, of course, higher hospitalizations, impact on economic and finances, work, access to care, to healthcare and treatment, and even mental health. So what, in your opinion, is the reason behind this disproportionate impact?
Well, yeah, I think that one of the most important things that has been unpacked as a result of COVID were the health disparities that already long existed in many of the healthcare systems in terms of how you know, people of color in general were treated or have been treated, and specific to this conversation, the Latino community. You know, what we do understand in terms of the health impact to the Latino community is that you're looking at least almost 178 more times where a Latinx person will be infected with COVID rather than any, you know, than their other counterparts, and trailing just behind the Indigenous community and the African American community, with the Indigenous community being number one. What you're also seeing is that in terms of the death toll, you know, the Latino community is coming in at, you know, second in terms of deaths related to COVID. And, you know, this impact is seen across the age span. So there's not one age group, right? You know, you look at the impact of COVID when it originally came out, there was a lot of discussion that the older populations were the ones that were going to get affected the most. And in fact, what we're looking at and what we're seeing in terms of trends is that, at least for the Latino community, every single age group, you know, that you were trailing second in terms of that, the impact of deaths. And then, you know, the other thing that was really highlighted during COVID, and you mentioned this a little bit, Betsy, is that, you know, in terms of the economic impact, what has happened to Latino households in terms of the serious financial problems that they're having, what has it meant for pay cuts, for furloughs, for being displaced, for not having adequate savings, you know, for a time like this, because many were living paycheck to paycheck. You know, what we know in terms of the data is that, you know, 72% of Latino households are facing serious financial problems, 72%, with 63% reporting that they've lost their jobs. And 87% of all of those saying that they are hitting the rate of financial instability. So this is not something that is just, related to COVID, right? This is related to every aspect of living for the Latino community, and thinking about what their survival is going to be if we can get past this, unbelievable disease in this pandemic.
Great, thank you so much. And along with the pandemic, there's also been an increasingly loud call to address racial disparities. And we've seen a growing movement that has presented how systematic racism has an impact on health outcomes in the Latino community. So how or in what ways has systematic racism specifically impacted Latino health?
Well, I think that part of what ends up happening, especially in different health systems, is, the disease expression may look different depending on the cultural variables, right? So one of the most important areas that we have to look at is like, how do Latinos respond to like pain and pain tolerance? How do we respond when we have to go to the doctor, when we're feeling sick? How long does it take us to go to the doctor when you're experiencing discomfort? Well, all of that adds to, when you compound all of those different variables in terms of the relationship with the healthcare system, you can then see, right, that by the time they're reaching an ER, they're sicker, they're worse off. Now the longevity of the disease has taken course, right? And then the expression of symptomatology is not accurate sometimes. I mean, it's so funny. I remember going to the hospital, into the doctors with my mom. And before my mom would actually get to what was bothering her, she had to go through the fact that like her hip was hurting her, but she's had migraine headaches for 6 weeks. And then her hair is falling out, her pinky toe hurts. And the doctor was like, okay, but why are you here? And so sometimes too is like, a lot of Latinos haven't been, supported in being clear around what the clusters of symptoms are. So then that makes diagnoses and treatment planning even so much harder. So, it's very complex. It's a very complex system. And I also think that sometimes the health system has been unprepared. When you look at racial disparities in terms of healthcare, they've been unprepared to really understand the importance of cultural competence. So, is there linguistic diversity when you enter an ER and when you're interacting with a doctor? Can somebody even understand if English is a second language or if they're monolingual? Is there patience that's needed when they are trying to describe the situations that are going on, with them? Are they taken seriously? Because a lot of what we've seen in terms of some of, the disparities that occur in healthcare are the different assumptions that are at play in terms of, the way that disease is managed, right? And that management is critical to make sure that there is an adequate treatment plan, which will lead then to better health outcomes.
Right, that's right. Well, I want you to talk a little bit about, because this is related to your book, and I do want to, you originated the urban trauma framework. So can you talk to us a little bit about what that is?
Yeah, sure. So urban trauma is a framework that looks at what we would look at in terms of the concept of racial trauma. And a lot of people may not understand what exactly is racial trauma. One of the things that I was positioned to do with this book is to be able to unpack the definition of that. Again, kind of what I talked about when I mentioned health disparities is that if we don't understand what we're experiencing and it's hard for us to verbalize that, then it's difficult for others to understand how to help us. So my purpose in writing Urban Trauma is to understand that our connection, and the interactions and the intersectionality of different systemic ways that racism has integrated into our society and the levels of systemic oppression affect our psyche, right? Our mental health is affected sometimes to the point that it creates a trauma response. And what urban trauma is about is creating a framework that helps us understand what is the history of racism and what are the different iterations of racism, in terms of its expression in this country. And then how does that racism, begin to unlevel our capacity for well-being. The second part that it talks about is that there's an intergenerational aspect that happens to racial trauma. And what people don't understand in terms of the biology behind it is that, there's a study that's called a body of study that's called epigenetics. And what epigenetics helps us understand is how do we inherit certain diseases. This is why when you go to the doctor, you have to fill out that form that says who in your family had diabetes or high blood pressure or cholesterol. What we're trying to do, as medical professionals is identify what is your heredity around that disease. Well, unfortunately, they don't ask those questions around trauma, but trauma is very much an inherited trait. So that means that if you've experienced trauma, if generations before you have experienced trauma through something called fetal programming, that trauma is passed on to your, to your growing embryo and to your child, and so forth until you break that cycle. The other piece that I really talk about in terms of urban trauma, so it follows a biopsychosocial model, is environment. How does continued exposure to toxic stress, continued exposure to, to oppressive systems, perpetuate this idea of trauma over time? So, putting that all together, then that is the framework of urban trauma. And then it solicits different ways in which we show up in the world. It affects our relationships. It affects the way that we show up at work. It affects how much a part of family or community we are, and a lot of times we don't connect the dysfunction that happens in our relationships, in our families, with our neighbors, in our communities, with the fact that we may have experienced a trauma event that no one's explained to us, right? And so this is what urban trauma is all about, is educating you around the possibility that perhaps if you do have it, there's help that you can get in order to engage in your healing path.
Awesome. That's great. And I will put information on the chat function about that later on. But that did bring up something that I heard, I've heard in the past, is when you are, speaking about the environment, you live in a certain environment and you're thinking, okay, I live in a really tough neighborhood. I'm walking home at night. I'm worried about someone might mug me or something's going to happen. So I get home and I go lay down in bed, but something might happen. So all that stress and all that affects our heart. We'll have high blood pressure, and then affects our heart. So it's like, it even affects us physically, like actual conditions, or chronic conditions.
Yeah. That environmental stressor will affect you physically. It'll affect you mentally. There have been studies that show that we may even drop over 30 IQ points depending on the level of traumatic stress that's happening in our environment. Can you imagine that? Yeah. 30 IQ points, not to mention, like you said, different things like high blood pressure, different physical symptoms. Mm-hmm. With children, you tend to see an overdiagnosis of things like attention deficit disorder or learning disabilities. Yeah. And what's important about this urban trauma concept is that, I'm not just talking about this from the perspective of a psychologist, but the American Academy of Pediatrics has issued a statement that they have indicated that racism is a public health issue, right? So this is not something that we're just talking about in theory. And they did a longitudinal study looking at over 180 specific research studies around this that all pointed to the same thing. Those kinds of effects that happen beginning in childhood can be traced right back to those experiences that you're talking about.
Wow. Well, we don't have a lot of time left, but I do have a couple more questions. So in your second book, you talk about allyship and the process of white people to align themselves with people of color through the lens of a person of color. And we've certainly seen that allyship in the current times, but how can we as Latino individuals ensure that we have better outcomes? So what can we do ourselves to ensure we have better health outcomes?
Yeah, I mean, I think that, there's the perspective of allyship, and, it takes all people to change the world. We can try to push forward and persevere despite adversity. And sometimes there are many of us who are successful, and sometimes there are some of us who are not, I would hope that when we anchor ourselves around the conversation of equity and justice, what we can start to do is even the playing field, right? And that instead of needing allyship, then, we would have an equal chance at all areas of life to be successful. I think that, what ends up happening is that we're having to achieve in spite of all of the adversities, right? We have to be, for those that are first gen in education, first gen here in this country, it takes a heavy toll, and the burden that you have to carry is a heavy tax that you have to, push on. And you're looked at as the hope for family, like many of us that may be on this, on this platform right now, or perhaps on this panel, that we're the ones to achieve, right? That we're the ones to make it. That is heavy. And a lot of times, you are the ones then responsible for making sure that you're bringing your family along. And I think there's a lot of, we have a lot of unbelievable qualities that make us, so super special and dynamic, right? Our love of people, our love of music, our love for food, our love for many different aspects of culture. I think that there's always an opportunity to make sure that we stay anchored in that, because that is what brings normal to us, that is what that is our commonality, the collective thing that we share. And it's going to be very important to be able to find our wellness as we're moving along. It's not just about the struggle, it's about being well along the way. And we ignore our mental wellness because we don't think that it's important. We haven't rated it as important, and it is more important than anything else that you will do.
And actually that's a great segue for my next question, is that we've been seeing a rise of mental health issues and more substance abuse or substance use disorders during the pandemic. So what tips do you have for individuals to cope with the difficult times that we're facing? And maybe what tips can you provide to community leaders? We have a lot of community leaders listening in also, and that those that are working to address mental health in our communities.
Yeah, mental health is paramount for this conversation. And I think that, there's something in the culture, and there's a narrative that we're going to have to fight that links mental health and mental wellness to weakness, or to locura, the loco, you're crazy, though they're just crazy, and that's in fact not true, and it's actually been a disservice to the Latino community, because something that is strongly tied to, for men, machismo, and for women not being able to be the providers and the supporters of households, and, and the go-getters from that perspective, and that the ones that, have to take the burden on, but you don't have to take the burden on alone, right? There's a reason why we can now seek treatment and seek help. And with that help, you can be in a better place to support your family and your children and your community. There's a saying that we as psychologists always talk about. When you're on a plane, there's a reason why when they're going through all that stuff in the beginning and you're sitting down and they're going through what the protocol is as a passenger, that they tell you, you know, if there was something critical that were to happen and we were to hit an imbalance in air and the air mask falls down, put your mask on first. And then you put on the mask of your children or whoever else is there with you. That's because it's important that we self-preserve. If we can't be at our best, if we are mentally unstable, if we are using substances to medicate our pain, then we're not good, not just to ourselves, but to other people. And somehow we convince ourselves that medicating ourselves with other addictions is the way to go. And it's not. That's actually the harder road.
Right.
You know, the easier road is to be able to sit with somebody and to talk through your issues, and for that person who is objective and outside of your home, so they're not included in the bochinche, you know, can actually really help you along through this process, right?
Yeah.
I'll say one more thing, Betsy, along that, because I think this is really important. Mm-hmm. The other part is that, you know, there's a lot of mistrust of different systems for the Latino community because of abuse. You know, I mean, just a few weeks ago, there was a release in the paper that showed that, you know, in detention centers, hysterectomies were being performed on women without their consent, right? And if we look at the historical aspect of medical experimentation, we understand that many Latinos have been victims at different times of that type of abuse. And so inherently, we may not think about it in our conscious mind, but inherently there's something always behind that says, well, what if they hurt me? What if they abuse me? What if they, you know, and so in a sense, we have to contend with that issue and in a lot of ways push past that. And the way you push past it is go see somebody that is culturally competent to be able to handle your mental health needs.
Yeah, and one last question before we move on, but this one came in through the chat, and this person is asking for if you have any suggestions for engaging kids, youth, teens that have stopped maybe coming to clinics or seeing mental health professionals that were referred by schools now that they're, you know, remote learning and it's so different now. So any suggestions on how they can be engaged to get the mental health care that they need?
Yeah, I mean, what's great, you know, in a sense about the accessibility to mental health right now because of COVID is that every clinic, at least that I'm connected with, and including my clinic integrated wellness group here in Connecticut, we have gone to a virtual platform. So we're able to do telemedicine and we're able to do the entire therapy session with kids on telemedicine. I mean, they're experts on being on their phones and all kinds of social media. So this is not something that's going to be foreign to them. And, you know, I think it's important for parents to seek out it might have to be outside of the school system because right now schools don't have the capacity for school-based health anymore, or they're struggling in that area. But go to an outside clinic and get your child to see a therapist through telehealth. That's going to be a very important and critical way to get them through this time because children are really, really struggling due to COVID.
Yeah, definitely. Well, thank you so much, Dr. Akbar. Thank you so much for all your words and sharing your expertise with us. Just so that everybody knows, I will be putting information on the chat function about Dr. Akbar's books, and you can get more information from there. But now I would like to introduce our next speaker. Just give me 1 second so that I can get to her. Okay, I did ask some questions, but we don't have enough time to get to all the questions. But also I did want to remind you that you can text SALUD to 40649 and you would be signed up to get health updates and wellness updates from Hispanic Federation and AARP. And now I'd like to introduce Veronica Segovia Bedong, and she is a senior advisor at AARP, and in her role, she applies more than 100 years of experience. I'm sorry, more than 10 years. They made you older than you are. More than 10 years of experience in digital, social, and mobile communications to reach consumers on key issues of health, security, and financial resilience across key channels. Thank you, Veronica.
Thank you, Betsy. And thank you to our esteemed guest speaker, Dr. Maysa Akbar. I have questions for you, but we've run out of time. I might put them in the chat. Your words were enlightening and encouraging. AARP is very proud to have partnered with the Hispanic Federation for this online event. I also want to thank each of our attendees for setting aside time to join us this evening. We know that your time is valuable and we appreciate you spending it with us. We hope you can use the insights and knowledge that were shared and even pass them along to others who may need them. By talking about mental health and keeping it a part of our regular conversations, we can all do a part to erase the stigma. As it has been discussed during this relevant interview today, and as my colleague Yvette mentioned earlier, we have the responsibility of getting our family and friends to the other side of this public health crisis. It is critical that each of us take steps to advocate for our communities to achieve better health outcomes. There is so much to be done, but through education and conversations like these, we can take a giant leap in the right direction. I'd like to encourage you to visit the website globalcouncilonbrainhealth.org and download the reports that are available there to you for free. That website again is globalcouncilonbrainhealth.org. Personally, I've printed the infographics from this site and pasted them to my own family's refrigerator. Also, to find the latest resources for coping with the impact of COVID-19, please visit aarp.org/coronavirus or in Spanish at aarp.org/elcoronavirus. Finally, if you need referrals for mental health experts, resources, and helplines, you can call the AARP Caregiving Resource Center. And I want to be specific that this is not a support line, but a resource for caregivers. So AARP's Caregiving Resource Center can redirect you to the appropriate resources you may be looking for. For English, that number is 877-333-5885. And in Spanish, you can call 888-971-2013. Thank you again to the Hispanic Federation for hosting this space. Thanks to all of you for your grace through this conversation. Have a good night and please take good care.